Every year in Africa, 1 million babies die before their first breath. Many of them in Nigeria. Not because doctors didn't care, but because they couldn't understand what the babies were trying to say. But one Nigerian, born in Abia State, believed he could listen. Not with his ears, but with AI. His name is Charles Onu. A quiet boy. Bookish. Grew up surrounded by blackouts, kerosene lamps, and broken promises. But Charles wasn't angry. He was curious. As a kid, he loved fixing things, old radios, broken phones, even torn books. If it could be repaired, he would sit there for hours, trying to bring it back to life. He once fixed a neighbor's wall clock just by guessing what was wrong. He was 10. By 15, he was building simple code on shared computers in cyber cafes. He couldn't afford his own system, but he had a dream. He wanted to build something that mattered. In 2009, he entered Covenant University, one of Nigeria's best. He studied computer engineering. He graduated top of his class. Most people would stop there. He applied for scholarships and earned a place at McGill University in Canada, one of the best research schools in the world. He packed his bags, left Nigeria. Cold weather, strange food, different accents, it didn't matter. He was there to learn. But while walking past the neonatal ward at McGill one day, he overheard a nurse say, "We lost another baby last night. No signs." Charles couldn't stop thinking about it. How could a newborn die silently? He began digging, researching, reading every medical paper he could find. And what he found shocked him. Birth asphyxia. The silent killer. It was responsible for over 900,000 infant deaths each year, mostly in low-income countries. And worse, most of these deaths could be prevented if detected early. Newborns can't talk. They can't point. They can only cry. And yet, doctors weren't listening. So Charles asked the question no one else did. What if their cry was more than just a sound? What if it was a signal, a code we could crack? That question changed his life. He started working on a project nobody understood. He called it Ubenwa, Igbo for Baby's Cry. The idea was wild. Use machine learning to analyze a baby's cry and detect life-threatening conditions just from the sound. When he shared it with other researchers, they laughed. AI can't do that. It's not practical. This isn't Silicon Valley. Some professors told him to pick a simpler topic. Investors ignored his proposals. Hospitals refused to share cry samples. And in one pitch, a panelist asked, "Are you building a toy or a company?" Charles felt humiliated. But he didn't stop. Because deep inside, he knew, if I give up, more babies would die. He started collecting infant cry recordings from hospitals, mostly in Nigeria. Day and night, he fed them into crude machine learning models. RAM would overload. Still, he kept going. Every failure taught him something new. Every rejection hardened his resolve. He ate cheap food, slept in the lab. Sometimes, he questioned himself. Is this madness? But then came a breakthrough. One of his models achieved over 90% accuracy in early diagnosis. A cry could now be read like a medical report. Pattern equals problem. Tone equals warning. Cry equals signal. Suddenly, what was once a joke became a miracle. But Charles had no money to scale. No team. No investors. He was building a solution. But no one wanted it yet. And just when he was about to quit, a surprise came in the mail. A letter. From Google. The subject line. "Congratulations, you've been selected." He blinked. It was real. Google had chosen him for the AI Impact Challenge Fellowship. A highly selective program designed to fund AI research solving real-world problems. Charles had been chosen not because he was popular, not because he was famous, But because his idea, UNTOLD, was too important to ignore. For the first time, someone believed that $25,000 grant wasn't just money. It was fuel. Fuel to keep the fire burning. Fuel to finally push his research out of the shadows. But that wasn't the only surprise. A few weeks later, another tech giant reached out, Nvidia. Yes, the AI chip titan powering Tesla, OpenAI, and the world's smartest machines. They wanted to support UNTOLD too, through the Nvidia Inception program. Suddenly, Charles wasn't just a struggling PhD student anymore. He was an AI founder. And now, the world was beginning to notice. Charles moved fast. He assembled a small team. Fellow Nigerians. Engineers. Researchers. Dreamers. They worked day and night, testing the model in new languages, new cultures, new hospitals. In Nigeria, they partnered with neonatal units in teaching hospitals. In Brazil, they collaborated with pediatricians and global health researchers. In Canada, they ran clinical validation studies using advanced cry datasets. And the results? Stunning. The AI could detect birth asphyxia and other respiratory distress cases in under 90 seconds. From a single cry recording. No needles. No lab test. Just the sound of a baby, and machine learning magic. For African hospitals with limited infrastructure, this wasn't just cool, it was revolutionary. A midwife with a smartphone could now scan a baby's cry and get a life-saving diagnosis within minutes. Doctors in remote villages could now make fast decisions. No power. No lab. No problem. Just a phone and the UNTOLD app. But behind the scenes, the pressure was real. Charles was still navigating two worlds. One, where babies were dying from lack of early detection. Another, where investors only cared about profit margins. They told him, healthcare startups are risky. Africa is not a scalable market. Sounds like charity, not business. But Charles refused to fold. He didn't build UNTOLD to impress Silicon Valley. He built it to save lives. And slowly, the world caught on. Media outlets started calling. MIT Technology Review. Forbes Africa. World Economic Forum. They called UNTOLD one of Africa's most promising AI healthcare startups. Still, Charles stayed humble. He wasn't chasing headlines. He was chasing solutions. And the more babies they saved, the louder UNTOLD's impact echoed. Back in Nigeria, the effect was spreading. Doctors began requesting access. Health workers started sharing results. Mothers who once lost hope were now sending prayers. A woman in Abia reportedly said, "This app had what I couldn't understand in my own child's cry." For Charles, that meant everything. Because this wasn't just technology. It was translation between a baby's pain and a mother's instinct. UNTOLD was finally becoming what Charles always dreamed it would be. A voice for the voiceless. But they weren't done yet. In 2022, after years of trials and heartbreak, UNTOLD officially launched its mobile platform. No longer a research project. No longer a dream. A real AI product. Built in Africa. For the world. But success is never safe. Not in tech. Not when global giants are watching. Behind closed doors, a storm was brewing. Charles didn't know it yet. But the AI race was heating up. And giants like Amazon, Microsoft, and Google Health were circling. And one question hovered in the air. Could this humble Nigerian founder survive the billion-dollar wave coming toward him? When UNTOLD finally launched, some people cheered. Some shrugged. But in the halls of power, in Silicon Valley boardrooms and biotech labs, they paid close attention. Because for the first time ever, a startup from Nigeria had beaten the giants to something big. An AI that could listen to a newborn cry and detect danger. With no wires. No blood. No expensive machines. Charles didn't build UNTOLD for the spotlight. But now, The spotlight was coming for him. In 2023, AI was exploding. OpenAI launched GPT-4. Google was racing to catch up. Startups everywhere were raising billions. Investors were scrambling for the next big thing. And suddenly, UNTOLD wasn't just a healthcare tool. It was a target. Big tech began exploring voice biomarkers, the same science Charles had pioneered years earlier. Amazon was testing AI for early disease detection. Google Health was working on AI diagnostics. And whispers began. Is UNTOLD ready to compete at that level? Charles knew what was coming. Pressure. Offers. Buyouts. Dilution. This was the AI arms race, and he was standing at the center. But Charles didn't panic. He didn't pivot. He didn't sell. Instead, he returned to the mission. Save one baby. Then another. And another. This isn't about ego, he told his team. This is about mothers who bury children because nobody listened in time. Our AI must never forget that. While others chased headlines, Charles focused on hospitals. He expanded UNTOLD's pilot program to more states in Nigeria. Trained frontline health workers. Integrated the app into neonatal units in India and parts of Latin America. And slowly, impact turned into influence. Governments began to ask, can we deploy this nationally? Global health orgs began to say, this is what AI was meant to do. And the numbers. They spoke louder than any press release. Over 10,000 plus babies screened. Dozens of critical cases caught in time. Hospitals reduced infant mortality by up to 30% in test regions. But the most powerful number was this. 1. Because behind every cry was one life. One future. One family that didn't have to mourn. Charles could have left. By now, he had multiple job offers from billion-dollar companies. He could have joined Google Health, Meta AI, or DeepMind. But he stayed. Why? Because this wasn't just tech. It was his people. He once said in an interview, Nigeria is not a market. It's a mission. Our problems are hard, but that's what makes them worth solving. And he proved it. While others used AI for ads, filters, and content, Charles used it to translate pain into data. To give the voiceless a voice. To remind the world that innovation can come from Abia, not just Palo Alto. By 2024, UNTOLD's valuation crossed the $100 million mark. They weren't just a startup anymore. They were a symbol. A symbol that Africa could lead. That Nigerian youth didn't have to wait for permission. That AI wasn't just for robots or billionaires. It could save lives right here, right now. Charles became a quiet legend. Not loud. Not flashy. But respected. Invited to speak at the United Nations, WHO, and Global AI Summits. His work cited by Stanford, Harvard, and Yale. Yet he never forgot where he started. In a noisy internet cafe in Abia. So what's the lesson? What's the message Charles O'Neill leaves behind? It's simple. Start with your people's pain. Solve it. And don't stop. The world will notice when your solution speaks louder than your accent. Let your work echo, like a baby's cry that someone finally hears. So the next time you hear a baby cry, remember, that sound once meant silence, death, loss. But now, because of a Nigerian dreamer, that cry means hope. This is the story of Dr. Charles O'Neill. And it's only just beginning. If this story moved you, even just a little, don't forget to like, share, and subscribe. That simple click might help it reach another Nigerian who's sitting on an idea that could change the world.